So there were some agencies that would like really just niche down into diabetes only and just do injection only and stuff like that. At some point, Medicare caught like kind of wind of that. And for one reason or another, didn't like that process. And so they put a cap on outlier payments. Now there's this cap on outlier payments. So this is very important to understand and keep track of in your agency, or you will lose a ton of money. The cap on outlier payments is that the total of outlier payments per month cannot exceed 10% of the total billing per month. What does that mean? Let's say you were supposed to get, we're just going to go like big round numbers so it's easy to calculate, right? Let's say you were supposed to get 2,000 for the episode, like just clean 2,000, right? But you have like a bunch of visits, and now with the outlier payments, that comes up to 5,000 for the claim. The part that shouldn't be more than 10% of your total billing is the outlier payment, not the base payment. So it's whatever's paid past the base payment. So if your base payment was going to be 2,000, but you got 5,000 instead, now you have $3,000 of outlier payments. You need to have minimally $30,000 of billing to get paid that $3,000. That is very important to think about when you are accepting patients. Of course, you don't always know when you take a referral what's going to be needed in that referral. So agencies are highly encouraged to like monitor this and, just make sure for your finances. So what happens to those payments if you're not getting paid for them? Is it like cancel? No, it's not cancel. Essentially, it goes into some credit kind of like calculation. And when you do have space for that, you will get paid for this. So let's say this month you had, back to our example, 2,000 base payment, 3,000 outlier, right? Let's say you had only 28,000 of billing, not 30,000 of billing. That means you're going to get paid 2,800 of the outlier, and 200 will go into this like pending kind of state until you do have space to then receive that amount.